So let's begin with the next chapter of parasitology, and that's the trematodes. I hope you've already read the cystodes and coming to this chapter after that. So the trematodes are going to refer to as the flukes, and they're going to look extremely flat. So now what are the different members that we're going to discuss under it? Schistosoma, Paragonimus westermanni, Clonorchis, Opisthochus, Fasciola hepatica, and Fasciolopsis buscae. Not just these, some more, but these are going to be the main ones. And I just want to tell you that all of them are grouped in one category. So put all of them under one and put ye S wala schistosoma into separate category, because I'm going to tell you a set of rules which will help you all throughout this chapter. Remember, the infective form for all is going to be the Metacercaria larva. For all of them, it is going to be the Metacercaria larva. However, if you ask me what is it that is for schistosoma, so schistosoma is going to be an exception all throughout. Schistosoma says, no, I need something with S wala sound. So for me, the infective form is going to be the Cercaria larva. Point number one. Second, the mode of infection. For all of them, the mode of infection will be eating of the Metacercaria larva, whereas schistosoma says, no, I need something with S. So for schistosoma, it's going to be skin penetration. This was a recent exam question also. For all of them, the eggs that we have are going to be the operculated eggs. So I'm going to show you those eggs also side by side. For all of them, it's the operculated eggs, and I hope you remember you've done it in the cystodes. How do the operculated eggs look like? These are the eggs which have a lid. Do you remember the mnemonic? Lid is for protection, and you need protection against what? You need protection against STDs. So T for trematodes, of course. What were the other ones? S was for which cystode? S was for Spirometra, and D was for a cystode called Diphyllobothrium latum. So operculated egg that you're talking about, the egg with a lid, that is going to be the STD mnemonic that we had studied. So trematode family, but all trematodes except, now there's one trematode which has to have the exception always, and that is schistosoma. So schistosoma says, I'm not going to follow that. I need something with S, and that S is going to be the spinous eggs, right? So it's going to have eggs with spine. Do you want to see those? These are these eggs. Can you see a spine here and a spine here? So these spinous eggs are the ones which are going to be with SSS. But how do I differentiate which kind of spine? So look at this, guys. Where is the spine over here? This happens to be a terminal spine, right at the end. So if you see terminal spine, schistosoma hematobium is the only organism that has a T in it. So hematobium is going to show me the terminal spine. One part of it is done. Where do you see this one? What is this? This is the lateral spine on the side. So I have learned that Schistosoma mansoni, man and soni, sleeping man, sota hua man, leta hua man. Okay, so laterally, leta hua, sota hua man, that is mansoni with a lateral spine. And here you can hardly see a spine. So what I refer to this as the rudimentary spine. This is the rudimentary spine, and please note, rudimentary spine is going to be seen with Japonicum. Japan is spineless. Or there's another mnemonic where people say Japanese people have round faces, they don't have sharp features, they have round faces, but I feel Japan spineless, वैसे भी याद कर सकते हो. So remember, terminal hematobium, lateral leta hua sota hua man, and rudimentary spine means there is Japan spineless. So coming back, all of them have operculated eggs, but schistosoma says I want a spinous egg. All of them are hermaphrodites, but schistosoma needs an S, so it says separate sexes. There is going to be a separate male and a female, that is worm, that is going to be present. So I hope till now it is clear. The drug of choice I'll come to right at the end, because here there is no exception of schistosoma. So till now remember, schistosoma says I need Cercaria larva as the infective form via skin penetration. My eggs are spinous and the separate sexes will be there. So now you will tell me that let's go on to their hosts also. Remember, for all of these, the definitive host is going to be all of us only. So that is going to be the human beings. Only in case of these fasciola वाला जो family है ना, तो इसमें fasciola में थोड़ा she वाला sound आ रहा है, fasciola, Fasciolopsis buscae, especially Fasciola hepatica can sometimes have the sheep also as the definitive host. That is why this is known as Fasciola for sheep and hepatica for liver. That is why this is known as the sheep liver fluke. That is the reason it is called as the sheep liver fluke. So all of them it is human. Only for this Fasciola, sometimes even for Fasciolopsis buscae, sheep can come. The first intermediate host for all of them is going to be the snail. So that is also common. So सबका definitive host is common, सबका first intermediate is common. What is going to differentiate? Second host is going to differentiate. So now Schistosoma says that listen, my rule of life was I need an S and you have given me the S. After this, I don't want anything else in life. So Schistosoma doesn't want a second intermediate host because Schistosoma is happy with the human and the snail. S mil gaya, story khatam. What is this? Clonorchis and Opisthorchis. From today onwards, please remember for both of these, the second intermediate host, they're like cousin brothers, same chalte. So for both of them, the second intermediate host is fish, and from today onwards, you will learn these as clonorfish and Opisthorfish, because that is how you're going to learn them, and that is how you will remember their host, because human and snail you will remember for all, but clonorfish and Opisthorfish will tell you the second intermediate host. Let's come to Paragonimus westermani. So first and foremost, remember para ko you will learn it as cara. Cara means there's going to be crab and crayfish. The second intermediate host is going to be crab and crayfish. Also, so read carefully in the exam. Have they mentioned fish? So fish hoga to clonorfish or Opisthorfish. Have they mentioned crayfish? Cara wala fish. Cara is para. Cara is gonna be para. Also, if you note P for P, guys, this is gonna also affect the lungs. That is why, what is the other name for this? This is known as the pulmonary fluke. This is referred to as the pulmonary fluke because Paragonimus is going to go into the pulmonary system. Okay, what am I left with? These two fasciolas, Fasciola hepatica, Fasciolopsis buscae. So fasciola is fine, but remember, if you pick up the FA of both, you will get for both of them, FA means fresh aquatic vegetation. Fresh aquatic plants or vegetation is what you're gonna get, and usually this is the water chestnut. If you want to know a little bit more detail, usually this is the water chestnut plant. Now the story is only over. The chapter is almost done. It's beautiful. This table is golden, trust me. So Schistosoma says human and snail, I got my S, I'm happy. I don't need a second intermediate host. Paragonimus says human, snail to sab mein hai. Para says I want cara, crab, cray. Clonorchis or Opisthorchis, they need fish. Then Fasciola hepatica and Fasciolopsis buscae for their FA, they are gonna need the fresh aquatic vegetation like water chestnut. So this is also done. I think now we can go into details, know everyone's name, know everything about it. So let's start with Schistosoma, which is known as the blood fluke, and by now you know Schistosoma hematobium mansoni japonicum. You know all the S's about it. You know all the eggs about it. Life is going to be so simple. You are going to finish this in 5 or 10 minutes. So look at this. This is how the adult worm. How are you so sure that this is Schistosoma ka adult worm? Because you can see a separate male and a separate female, and if you're seeing separate sexes, it has to be a Schistosoma only. What do I see? I can see 2 suckers over here. So yes, there are 2 suckers, and just behind the sucker, can you see there is a canal, gynecophoric canal that is beginning. So if you look a little carefully, just before this, you will see a gynecophoric canal, and what is held on by the gynecophoric canal? You will see, acha ye big wala jo hai, you can see this is the male, and just behind the gynecophoric canal, it has held on to the female. So basically, that is what you need to know. That just behind, that is the only part of this diagram that you have to know. So just behind the gynecophoric मतलब gyne को hold on करना है, gyne को मतलब female. Just behind the gynecophoric canal, the female is held, and that is what is the identification point of Schistosoma. Okay, this was the adult worm, but tell me one thing. For Schistosoma, was it infective form क्या है? Cercaria larva or metacercaria larva? Infective form, S wala. Cercaria larva. How do you identify this in the exam? Infective form for Schistosoma is Cercaria larva, and you identified by the forked tail. You identified by this tail. There is no other form which is going to have a forked tail. Suckers to chalo sab mein hai, but this forked tail is very, very important. So now if I show you this life cycle, you will realize that firstly, how will you pick up in the exam that this is the life cycle of trematode family? Human, snail, human, snail. So here you have a human and here you have a snail. So trematode family to pakka hai. And after that, you don't have any other second intermediate host. So if you're only dealing with human and you're only dealing with snail, nothing else, this means it is a case of Schistosoma. Okay, now let's see what are the S's that you had studied, guys. What is the infective form? Can you see the forked tail wala? The infective form is going to be the Cercaria larva. Okay, how is it coming? S says, is it coming by eating or by skin? So you will say, obviously, this is going to penetrate the skin. So there is going to be skin penetration. After that, male, female separate. Yes, I can see the separate sexes also going on over here. After that, once the male and female will mate, I can see the eggs being laid down. Guys, how are the eggs? Look at the eggs. The eggs are having a spine. If the eggs are having a spine, this means these are spinous eggs. Matlab again, this is schistosoma. Okay, after this, maybe you don't know the rest of the life cycle. Yahan tak to you knew. Cercaria larva with skin penetration. Cercaria with skin, with separate sexes, with spinous eggs. Now after that, what happens? In every trematode cycle, from the egg, you have some larvae that are formed, and that is known as MCRC. Pehle to please learn it once and for all. What is MCRC? Because you will see these random words written. Can you see? Miracidia written, then can you see cysts written over here? Then you will have something called radia, cercaria, metacercaria. ऐसा कुछ लिखा होगा. So you will keep getting confused. Once and for all, learn it. What is MCRC? So M stands for Miracidia. The first thing formed is Miracidia. Then C for cysts are formed. Then we have radia which is formed. Then there is a Cercaria larva that is formed, and after MCRC you will like to go back to the M, but that M is not going to be Miracidia, that M is going to be the Metacercaria larva. The M is going to be the Metacercaria larva. So MCRCM, MCRC, everyone mug it up, MCRC, but when I'm dealing with schistosoma, tell me, is Metacercaria larva the infective form or Cercaria? So you will say, ma'am, Cercaria hai, to Metacercaria to hoga hi nahi. There is nothing known as a Metacercaria larva. Secondly, there is one more form that is not there, and that is radia. Everyone please note that in the MCRC, only for schistosoma, baki har jagah MCRCM, MCRCM, repeat, MCRCM. Every life cycle of trematode will go that way. But when I'm talking about the schistosoma, the radia is not there, and the metacercaria to cannot be there because cercaria has to be the infective form. S I have to listen to. So can I say, all in all, MCC, सिर्फ CCC, वो SSS वाला sound वाला चीजें you will keep, and that is what is the schistosoma. And you can, if you feel only MCC, yes, I can see, ma'am, this was the egg. From the egg, the first thing you came out was Miracidia that went into this snail, as I can see. After that Miracidia, the cyst came out, and सीधा उसके बाद Cercaria larva बना. R is not there, radia is not there, Metacercaria larva not there. So like I said, only MCC will be there. That is what is schistosoma. Sorted with this life cycle, because now obviously you want to know which schistosoma, ma'am. Manzoni, Japonicum, or you're talking about what? Because if you look carefully, they have given you ABC. And they have labeled ABC. They have made schistosoma hematobium here in the urinary bladder. They have made Japonicum over here in the small intestine, Manzoni in the large intestine. So how do I differentiate between these and what do they cause? Please remember, schistosoma hematobium is going to cause hematuria. Okay, it is going to result in hematuria. Whenever something results in hematuria, means it is going into the urinary bladder, means the cancer that it causes is squamous cell carcinoma more commonly than transitional cell carcinoma. So all its problem is going to be in the urinary bladder. Remember, hematobium causes hematuria, and which cancers? Urinary bladder, of course. But remember, S for S. Schistosoma means squamous cell carcinoma is more common than transitional. So your previous year question is, schistosoma hematobium causes SCC, TCC, both. It causes both, but commonly S for S. Again, S has to be there. So where do you think it's going to reside? Which venous plexus? If it has to go and hit the bladder, it is going to reside in, obviously, the pelvic and vesical venous plexus. Pelvic and vesical means, obviously, bladder wala plexus. Now coming to schistosoma Manzoni Japonicum. First question is, which is going to be ileocecum, small intestine? Which is going to be large intestine? So simple, small intestine I and J come together. Japonicum goes in ileum. Japonicum is going to go in ileum, ileocecal region. That means that is the superior mesenteric venous plexus that is going to go into the ileocecal region. So obviously Manzoni will go into the large intestine, the sigmoidorectal, and that will be by the inferior mesenteric venous plexus. So as simple as that, ileocecum may we are going to have the Schistosoma japonicum. But what do they do between Schistosoma manzoni and Japonicum? What do they actually do? They result in swimmer's itch. Swimmer's itch matlab, and Japonicum also is going to result in a more severe form of swimmer's itch. But what is that swimmer's itch? Because this is coming through the skin, na? It's coming swimming through the skin. So wherever it will come or penetrate over there, there's going to be a lot of itching. That could be the neck or the shoulder or the hand, wherever it's entering from, there's going to be a lot of itching. That is going to be seen with Manzoni and Japonicum, but more severe with Japonicum. And let me tell you, this Japonicum is also going to result in genital schistosomiasis, which is a previous year question. It is also going to result in CNS schistosomiasis. So everything severe is coming up. So remember, Japonicum pe genital, Japonicum pe genital, and also the brain, CNS, because all severe things are happening over here. Both of these are previous year questions. Okay, moving on further. So Japan is coming out to be quite deadly. Japan wala kafi dangerous wala lag raha hai, right? So now what is this entire disease known as? Whenever schistosoma causes a disease, that is known as schistosomiasis, or it is also known as bilharziasis. This is also another fancy name that you have. So hota kya hai? What is this schistosomiasis? What is the swimmer's itch? And also in acute schistosomiasis, there is something known as Katayama-like fever. So patient has basically a serum sickness like of an illness. Fever hota hai because starting hai, acute phase hai. But in chronic condition, anything chronic will result in fibrosis and granuloma. If I go to my basic pathology part, general path mein dekho, chronic inflammation mein kya tha? Granuloma tha, healing. So granuloma hoga, healing hoga. Healing means fibrosis. So chronic schistosomiasis will result in granuloma formation and pipe stem fibrosis. I have written periportal, matlab this is gonna occur in the liver. This is pipe stem fibrosis. So what can you see? All this brown color must be the normal liver. And what I see additionally along with these white bands, so these white bands are referred to as the pipe stem fibrosis. That is the pipe stem fibrosis. So repeating, in acute you see Katayama-like fever, lots of fancy name, bilharziasis, or we have Katayama-like fever, and chronic mein pipe stem fibrosis. Now you tell me how are you going to do the diagnosis? I think that much you know, but before I come down to that, I think one part of it that I want to definitely mark to you people is Schistosoma intercalatum, which no one studies about. Everything is the same. You will say that ma'am, Schistosoma intercalatum, spinous hota hai, Cercaria larva, separate sexes, yeah, all SSS, snail, everything SSS. But remember, intercalatum has lots of T's, na? So this also has what kind of an egg? It also has a terminal spine wala egg. Which other one had terminal spine? Schistosoma hematobium, that also had a T, so that also had terminal. Intercalatum also has T, that also has terminal. This is the one that can be acid fast at times, and this is not something we see in our country. It is more commonly seen in Africa. So quickly telling you what was the diagnostic ability. You know, for the diagnosis you're going to look at these, and now you can kind of analyze. Hematobium, because hematuria, urinary bladder hai, so you will see this thing in the urine sample maybe. And these two, which are small intestine, large intestine, these eggs you will see in the stool sample. Common sense lagana. So now if I give you that life cycle one more time in your life, and I say that if the examiner only gives this egg, if the examiner only gives this egg in the exam and says this is the egg that has come out in the urine, you will say, oh, ye to terminal spine hai, and urinary bladder, ye hematuria hoga, this must be hematobium. So he can not only give you this life cycle, depending on the egg, he can ask you which schistosoma you are dealing with. Let's move further. Treatment I'll take for